Assalamu alaikum. Today lecture about transportation of patient having intra-aortic balloon pump, and the lecture will include transportation through ambulance or medevac, and what the change occur during the transportation. First step, parallel transport. For any patient transported with intra-aortic balloon pump, we should have a transport checklist. First, we should notify the transport company if we will transport with ambulance or aircraft, if there is rooming to accommodate the patient or not, and the patient with the bed or presence of the balloon or not. Second, confirm presence of bed availability in the other facility, so the patient can be transported and they are prepared with their equipment and the connections for the patient with intra-aortic balloon pump. Very important point to prepare transport pack for intra-aortic balloon pump, which will include 60 cc slip-tap syringe if we have a console failure or a problem in the power supply or anything, so we can inflate and deflate the balloon manually. Appropriate intra-aortic balloon tubing and connectors packs, scissor or tube clamps, ECG patches, extra helium tank, ECG and arterial pressure cables, intra-aortic balloon flow sheet, and also presence of the operator's manual if we have a problem. Also, we should check intra-aortic balloon pump battery, and we have full battery charge and another backup one. Verify presence of helium supply and another backup helium supply. Verifying ECG signals, and we shouldn't depend on one signals only. We should use the balloon signals and remote balloon signals, remote signals for the ECG. Also, we should have work well connected through the monitor. All charts and things are gathered for the patient to be sure that everything is will be delivered to the other facilities. During transportation, we took the patient and we are on the ambulance. What we should look for? Are going to transport the patient, we should first assess the patient position, ensuring that the patient is comfortable in his position in the vehicle. And the screen clearly seen with the alarm, we can see it very well. And the second thing, securing the intra-aortic balloon pump in the vehicle. It should be properly secured to prevent the movement, as with securing straps or mounting brackets may be required. Also, the wheel should be locked. Clear full patient assessment should be done by monitoring the patient condition, first like vital signs, blood pressure, and heart rate, every details. See arterial pressure waveform to see the timing and optimal diastolic augmentation. Assess the patient regarding the rhythm, urine output, peripheral perfusion of the pedal pulse. And we should assure that gas alarm is enabled all the time, and our eyes should be on the screen if we can't hear the sound of the alarm. Transported the patient by ambulance or medevac, we will have motion thickness in the patient. And if we have motion thickness, it will be more aggravated by medevac, but it will be also present in ambulance. So it's better to have oxygen administration, low oxygen flow to avoid nausea. Also, we can giving antiemetic to prevent nausea and vomiting. A patient will go for medevac. It's better to insert nasogastric tube to avoid or relieve the stomach pressure, as presence of motion sickening vomiting will affect signals of the intra-aortic balloon pump and affecting the triggering of the balloon itself. Patients who are transported by medevac, attitude will affect the drug. So CNS depressant should have reduced the doses, their effect will increase. Benzodiazepine will have greater side effect, so we should be careful if we need to increase the dose. Antihistaminic will lead the patient more susceptible to hypoxia and increase the risk for to the patient with hypoxemia. Also, a morphine will have greater side effects, and if we need to use it, we need small incremental doses. Effectively, we can use supportive equipment during patient transportation. First, we should have access to the defibrillator, ensuring the patient's chest is accessible for hand-free defibrillation, and we can reach it very easily. Also, we should note that patient has external beds placed properly before transport the patient. Patient milliampere management of the pacemaker. This is presence of connecting pacemaker. It may interfere with ECG utilization or ECG triggering for the balloon. So at that time we can connect arterial pressure waveform as backup to trigger the signals. We should also have battery preparation to carry extra batteries for a temporary pacemaker and generator, and also extra batteries for the intra-aortic balloon itself. The difference between transporting the patient through medevac or transporting the patient by ambulance. What's the consideration we should have? As we are going to high altitude, we will have altitude-induced hypoxia and equipment malfunction. There will be decreased oxygen pressure, so will lead to hypoxia at high altitude. Presence of gas expansion in anti-aortic balloon pump will carry the risk for helium leak of affecting patient safety. Patient pre-existing condition will have vulnerability to attitude change. If there is insufficient oxygen administration, can lead to clinical patient deterioration. Inadequate monitoring equipment will increase the chance for alarm status during the transport. Unpressurized helicopter environment will limit attitude adaptability for the patient. Different position of the patient and its effect on hemodynamics during the flight. If the hip forward, the patient experience positive acceleration, decrease load, and potential rhythm disturbance. If the feet forward, experience negative acceleration, increase preload, and there is a potential for bradycardia. Now, we are thinking how to compensate for hemodynamics changes during the flight. As we can, we should inform the captain to adjust the flight angles, optimize the flight path to reduce the hemodynamic strain. And regarding our work, we ensure intravascular volume, and we should maintain blood circulation and support medical devices. If needed, we can use vasoactive drugs, preparing the body for the flight stress by regulating the blood flow. Also, close observation, allowing for immediate response to hemodynamic changes. We have two types of flights, and each one has its vibration and impact on aircraft system. First one, fixed wing aircraft. In this affection, it will have high frequency vibration and will lead to loose connection risk. Rotary wing aircraft, it will have low frequency vibration and more or less ECG artifact risk. We have noise in the air in ambulance, so we will have multifaceted impact on the noise in the air and the ambulance. It will interfere with the clinical assessment. Also, we need protection for the healing, and at that time we should see the alarm on the console of the intra-aortic balloon pump and see the alarm in the monitor if we can't hear or tolerate the noise. Also, we should have clear way of communication between the medical teams or and the captain, if we can't hear each other, we should have another way of communication to avoid any complication. Here, this is a pre-checklist of the example of pre-checklist of intra-aortic balloon pump. Pre-transport formation, the patient name, vascular access, vital signs, and the drugs is the site of insertion, its place, the balloon size and catheter, and the equipment checklist as we mentioned, and the aortic balloon pump bag transporting list. And this sending facilities what they should have, and during transportation the position of the patient and pump in the vehicle, allowing good access for the groin, it's very important, and balloon tubing, and securing the pump and locking the wheels, connecting the power as soon as possible, and the position of the control bit. We should know that patient while he are in transportation maybe have some side effect like dislodged caster, bleeding. We shouldn't manipulate the intra-aortic balloon pump while or reposition it or pushing it inside the patient. We shouldn't have that. If the console failure, we use a 60 slipped syringe to manually inflate the balloon. If we have a problem regarding gas alarm, we should check it and clamping it immediately, the balloon, to avoid gas leak inside the patient. And we should have a good experience to deal with the vasoactive drugs and the volume while we are managing the patient during the transportation. Here are more references about the lecture for more reading about it. Thanks. You can post your comments and questions in the comments below.